Welcome, everyone, to the General Medical Plan Benefits Overview for Medicare Retirees webinar. We're happy you're joining us today. My name is Holly Lopez, and I am a staff member with the Health Service System. I'm joined with several other staff members from HSS, the Health Service System, and who are listening in and ready to respond to questions as we go through our webinar. We also have health plan representatives from Kaiser Permanente and Blue Shield of California. And we have our chat is live right now. Feel free to say hello. We want to know that you can hear us and see us. And for you to know that the chat will be live during the entire meeting. You won't be able to mute yourself. We really want to activate the chat to be able to see your questions and understand them thoroughly. And we have three portions today. Our first portion is going to be an introduction overview of the benefits and the plans. And then there will be individual pre-recorded presentations from both Kaiser Permanente and Blue Shield of California. And then our third and final portion will be a Q&A section, question and answers, where both our plan reps and our health service staff members will be ready to respond to the questions that have coming through during those pre-recorded presentations and then in the moment. And we're dedicated to staying on till the full hour is complete to make sure that you've got your questions answered. So with that, I can see our chat is activated and I'm going to start our pre-recorded introduction. Give me just a few moments while that transitions over.
Welcome to the San Francisco Health Service System Open Enrollment webinar. We're so glad you've joined us today to learn about your benefits for plan year 2025. The open enrollment period is the time each year when all members can enroll in benefits or change their current benefit coverage for the upcoming calendar year. During this period, you can change from one plan to another, waive your coverage, add or remove dependents from coverage, and enroll in flexible spending accounts. If you do nothing, your current benefit elections will roll over to the next plan year. However, flexible spending accounts do not roll over. Eligible members must re-enroll in the flexible spending accounts every year to participate. All new benefit choices are effective January 1st, 2025. Here are some key dates for plan year 2025. Open enrollment starts at 8 a.m. Pacific Time on Monday, September 30th, 2024, and ends at 5 p.m. Pacific Time on Friday, October 25th, 2024. You may enroll through the e-benefits portal on the San Francisco Employee Portal. Paper applications must be postmarked by October 25th, 2024 to be accepted. During the webinar, all attendees will be muted and off camera for the entirety of the presentation. We encourage you to ask questions at any point during these presentations. To ask a question, open a chat box by clicking on the chat icon in your menu bar. You may find the menu bar either at the top or bottom of the screen, depending on whether you are using a computer, a mobile device, or a tablet. We will answer as many questions as time allows during the Q&A portion of the presentation. Important. Please do not share personal medical information in the chat. All chat text is viewable by all attendees, and we recommend a one-on-one consultation if you have specific personal concerns. If you have a question that includes personal or private medical information, please schedule a private one-on-one consultation with our health plan vendors during our open enrollment office hours for SF-HSS members, which can be found at sfhss.org/OE2025. If you have eligibility questions, please call SFHSS Member Services at area code 628-652-4700 or visit our offices at 1145 Market Street, 3rd floor, during our business hours listed on the screen for further assistance. And lastly, we want to remind everybody to get their annual flu shot and COVID booster to protect yourself and your loved ones during this fall and winter. And with that, our presentation will now begin.
Thank you for joining the SFHSS Blue Shield Medicare PPO webinar. We look forward to help support you and your loved ones when it comes to your health and well-being. In this short presentation, we are going to cover what Blue Shield Medicare is and how it works. We will also share information on transition of care from United Healthcare to Blue Shield of California. Blue Shield Medicare offers comprehensive medical and Part D prescription drug coverage with the freedom and flexibility to access care from in-network and out-of-network providers nationwide. This plan may be a good fit if you like to self-refer to specialists and see both in-network and out-of-network providers. Plan highlights to take note of are no-to-low copayment for most Medicare-covered services, access to virtual health care with Teladoc doctors, and coverage for medical care across the United States, including urgent and emergency care anywhere in the world. Blue Shield Medicare gives you flexibility and choice. You can choose to receive care from Blue Shield Medicare in-network providers. This option allows you to pay your coverage copay, and the provider will bill us directly for covered services. Or, you can choose to receive care from out-of-network providers that participate in Medicare and are willing to treat you. Here are some helpful tips before seeking care from out-of-network providers. Check with your provider before receiving services to confirm that they participate in Medicare. If you receive care from a provider who does not participate in Medicare, you will be responsible for the full cost of the services you receive. You don't need to get a referral or prior authorization when you get care from out-of-network providers. However, before getting services from out-of-network providers, confirm that the services you are getting are covered and are medically necessary. It is best to ask an out-of-network provider to bill the plan first. But if you have already paid for the covered services, we will reimburse you for our share of the cost of covered services. Or if an out-of-network provider sends you a bill that you think we should pay, you can send it to us for payment. As you can see on this chart, your Blue Shield Medicare plan gives you the flexibility and choice to not only see in-network doctors and healthcare providers, but also out-of-network doctors and providers at the same cost share as long as they participate in Medicare and bill Blue Shield of California. There are no deductibles and no-to-low copayments for most covered services. Coverage includes a $0 copayment for routine hearing exams and a $2,500 allowance per ear every 3 years for the purchase of hearing aids. Blue Shield Medicare gives you access to pharmacies that offer preferred cost sharing across the United States. Major pharmacy locations include Albertsons, Costco. A member doesn't need to be a Costco member in order to obtain covered prescriptions here. CVS Pharmacy, CVS Pharmacy at Target, Safeway, Vons, and Walmart, where you can receive a 3-month supply for 2 months' worth of copay for most drugs. You may also have your maintenance medication delivered to your home or office at no charge for shipping. Signing up for home delivery pharmacy saves you a copay. Receive a 100-day supply for the cost of a 2-month supply of covered maintenance medication. To find a network pharmacy near you or more information on formularies and home delivery prescriptions, visit our website at blueshieldca.com/sfhss. Blue Shield Medicare provides coverage for routine acupuncture and chiropractic care at a $15 copay per visit for up to 24 visits per benefit category per calendar year. These are non-Medicare covered services. No need to see your physician of choice for access. You can self-refer to any chiropractor and acupuncturist in the American Specialty Health Plans of California ASH network. To find an acupuncture or chiropractor provider, go to blueshieldca.com/find-a-doctor. For out-of-state acupuncture or chiropractic services, call Blue Shield Medicare's dedicated customer service team for assistance. Your Blue Shield Medicare membership comes with additional benefits: vision coverage, transportation for non-emergency medical appointments, personal emergency response systems that keep you connected to your caregiver network, gym membership with the Silver Sneakers fitness program, and a home meal delivery service to help with your recovery after being discharged from inpatient hospital or skilled nursing facility care. To find out more about the benefits, visit our website at blueshieldsca.com/sfhss. Getting answers to your urgent questions has never been easier. The Blue Shield Medicare SFHSO website gives you 24/7 access to health plan information. With only a few clicks, you can get an overview of your Blue Shield Medicare plan, find in-network doctors, download plan documents, and get details on some of the benefits like emergency and urgent care around the world, preventive care coverage, 24/7 virtual care with Teladoc, and so much more. To ensure a smooth transition of care, members will have direct access to Blue Shield Medicare's dedicated customer service team to answer any questions members may have regarding the plan. Additionally, the highly skilled Care Navigator team is here to help with scheduling appointments and care coordination. Members receive dedicated support from the pharmacy technicians on any pharmacy or formulary questions. Blue Shield's pharmacy implementation team is working closely with SFHSS and Optum Rx to help ensure a seamless transition. To help ensure continuous medication access, existing open refills for home delivery and specialty pharmacies will be transferred with member enrollment. Members will have access to a concierge team with pharmacy benefit specialists to help answer inquiries about the Blue Shield pharmacy benefit and network. And lastly, Blue Shield is disseminating proactive communications with educational materials help facilitate formulary transition and mitigate disruption. In addition to medical and pharmacy benefits, Blue Shield Medicare members have access to behavioral and physical health benefits. Call Blue Shield's highly trained Medicare customer service team to receive help with questions about behavioral health benefits. As mentioned earlier, your Blue Shield Medicare membership comes with the Silver Sneakers benefit, which includes a gym membership, community classes, and online programs to help with your overall well-being. We know you have many choices, and we appreciate you investing this time with us. To learn more about the Blue Shield Medicare plan, visit our website, blueshieldca.com/sfhss. Thank you.
Hello and welcome. To find your healthy place, you and your family need high-quality care that is simple and personalized. At Kaiser Permanente, we're both a care provider and a health plan which makes your life easier. Today, I'll be highlighting our integrated quality care, digital care options, and membership perks. This shared information will help you select with confidence the right health plan for you and your family. Before we start, please tell us what you think. We invite you to complete a 3-question survey at the end of the presentation, which will take less than a minute to complete. Now, are you ready to get started? Great, let's begin. Kaiser Permanente provides high-quality care designed for your total health. That includes care for routine checkups, complex treatments, and mental wellness, and care for building strength, reducing stress, raising a family, and new goals. No matter what your priority is, ours is providing excellent care when and where you need it. We can help you get to your healthy place no matter where it is. We combine care and coverage, which makes us different than your healthcare options and gives you peace of mind. With us, you get connected care. What this means is your doctors, pharmacy, and lab are connected to each other and to you. Through our electronic health record, they can see your health history such as your conditions, medications, and allergies, making it more convenient for you to get the right care when you need it. At most of our facilities, you can see your doctor, get a lab test or an X-ray, and pick up prescriptions, all without leaving the building, making your care feel easier, faster, and centered around you. Now let's go into more details about the Kaiser Permanente plan options available to you, including high-level coverage amounts. You can choose from the following medical plan options. Additional covered benefits include the following. Now let's take a closer look at the high-level coverage amounts of your plan options. For specific information about your covered health plan benefits, limitations, and exclusions, please review your evidence of coverage or speak to your benefits administrator. If you need additional time to review this information, press the pause button in the lower left-hand corner of the screen at any time. Here is an overview of the plan option being offered to you. Chiropractic and acupuncture care services are also included. These services are covered when provided by an American Specialty Health Plan participating provider. You can obtain chiropractic and acupuncture services without a referral from a plan physician. Call or visit the website on the screen to find a participating provider near you. At Kaiser Permanente, your personal doctor is your best health advocate. They coordinate your care with a multidisciplinary care team and make your health their top priority. Our industry-leading preventive screening rates help your care team catch problems early. And if you mean specialty care, your team can connect you with specialists in one of the largest multi-specialty medical groups in the country. If you have a condition like diabetes or heart disease, you're automatically enrolled in a disease management program for personal coaching and support. Every contact with your care team is recorded on your electronic health record, which you and your doctors can access and review anytime, anywhere. This ensures that every caregiver you see has a full picture of your health, without you having to repeat your story. From virtual care, video, and phone visits to in-person appointments, you can choose how, when, and where to get care for you and your family. Plus, stay on top of your care 24/7 with the Kaiser Permanente app or at kp.org. If you prefer to visit in person, same day, next day, and weekend appointments are available at most locations, and many facilities have labs and pharmacies in the same building. Because your mental health and lifestyle are essential to your total health, Kaiser Permanente includes many resources for self-care at no extra cost. Get reduced rates on in-person fitness classes from ClassPass and access to 4,000 plus on-demand video workouts at no additional cost. Kaiser Permanente doctors have one priority: your health. Your personal doctor is your best health advocate. They coordinate your care with a multidisciplinary care team and make your health their top priority. Our doctors and caregivers reflect the diverse communities we serve and provide culturally responsive care in many different languages. Your care team also uses your electronic health record to help you schedule checkups and tests. When you need care, you can talk to a clinician in person, over the phone, or by video. Same day, next day, and weekend appointments are available at most locations. You can also get advice 24/7 over the phone and online through an e-visit at no cost, saving you time and money. Telehealth services are not an add-on at Kaiser Permanente. They're covered at no additional cost by most plans and have been a part of how we deliver personalized care. If you prefer to visit us in person, it's easy to schedule an appointment at a location near you. No matter where you are, your Kaiser Permanente care team can see your medical history on your electronic health record, so you never have to repeat your story. And because services are connected, many Kaiser Permanente facilities have pharmacies, labs, and other services all in the same building, so you can get more done in fewer stops. It's easy to refill prescriptions in person, over the phone, online, or on the Kaiser Permanente app. You can have most delivered to your home with same-day or next-day delivery, or order your prescriptions for same-day pickup. Get refill reminders or alerts when new prescriptions are available to order via text, mobile app notifications, or email. You can also place some orders by responding directly to our text message reminders. We'll provide status updates via text or email about shipping, delivery, or pickup information. Since keeping you safe and healthy is our priority, you're covered for emergency and urgent care anywhere in the world. You can also get urgent care at Minute Clinics located in select CVS and Target stores, the Little Clinic locations, or Concentra Urgent Care Centers when traveling outside a Kaiser Permanente area. If you seek urgent care at a Minute Clinic, the Little Clinic, or Concentra Urgent Care Center in a state where Kaiser Permanente is located but are outside one of our service areas, you'll be asked to pay upfront for services and need to file a claim for reimbursement. To make getting care while traveling more convenient, there's the Away from Home travel line available 24 hours a day, 7 days a week. kp.org/travel is a special section of our website that's focused on getting care while traveling, and you'll have the ability to refill eligible prescriptions early in preparation for travel. When you're dealing with a serious health issue, your health becomes the center of your world. That's why you're at the center of everything we do at Kaiser Permanente. We're known for catching potential problems early with our robust preventative screening rates. If you do have a condition that needs more attention, you get excellent care from top-notch doctors across a wide range of specialties, including cancer care. Hearing that you have cancer can be overwhelming. But no member or doctor goes it alone. A multidisciplinary team of cancer specialists works with you and your family to determine the best approach to your treatment. Our experienced specialists combine earlier detection, cutting-edge research, and compassionate care. And we have access to groundbreaking clinical trials and other cancer research. We know that no two hearts are alike. There are many types of heart disease, and different people need different types of care. From initial diagnosis through treatment and into recovery, you and your doctor will make decisions about your care together, and you'll have guidance and support at every step. Through evidence-based treatments and comprehensive care and support, we help many members with heart disease live longer, healthier lives. In fact, Kaiser Permanente outpaces the nation in reducing deaths from heart disease and stroke. And our approach to prevention helps others avoid heart disease altogether. We make it easy for you to work out from anywhere with ClassPass. Members get unlimited on-demand video workouts at no cost and reduced rates on in-person fitness classes. Once you activate your ClassPass account, you have access to more than 4,000 on-demand fitness classes online. To access this complimentary benefit, visit kp.org/exercise. At Kaiser Permanente, we believe in nurturing the mind, body, and spirit as well as your total health. Get fresh, nutritious meals delivered to your home at no charge. As a Kaiser Permanente Medicare Health Plan member, you can get fresh, healthy meals delivered to your home immediately following an inpatient stay at a planned hospital or skilled nursing facility. Need a ride to the doctor? Your plan covers that. You can get a ride to and from your doctor visits at no charge up to 24 one-way trips or 50 miles per trip per calendar year. Your mind and body are connected. What you think, feel, and do affects your total health, and we are committed to caring for the whole you. We provide clinical and support services for a wide range of conditions, from stress and anxiety to drug dependence and autism spectrum disorders. Our mental health includes psychiatrists, psychologists, as well as family therapists, licensed clinical social workers, and addiction medicine physicians. And as a Kaiser Permanente member, you don't need a referral for mental health care. We also provide members with tools and resources to process self-care like guided meditation and wellness apps. Now let's see how we are using technology to give you more convenient ways to get care. Here are some of the wellness resources to help you stay healthy once you register at kp.org. Get reduced rates on in-person fitness classes from ClassPass and access to 4,000 plus on-demand video workouts at no additional cost. Join a program to help you lose weight, reduce stress, quit smoking, and more at no additional cost to members. Find helpful videos and articles, health calculators, podcasts, recipes, and more. Lastly, get one-on-one guidance and support from a dedicated wellness coach who can help you set goals, stick to them, and, most importantly, see results. And you can do it all from the comfort of home. Partnering with a wellness coach can help you manage your weight, reduce stress, quit tobacco, eat healthier, and increase activity. As soon as you join, we want to make your care experience easier. We provide personalized onboarding with a welcome call and a member guide, so it's easy to get started. You can also visit kp.org/new member to get registered, choose your new doctor, transition your care and prescription seamlessly, and schedule your first appointment. If you still have questions, we are here to support you.
Thank you. This completes our presentation. May you live well, be well, and thrive.
Thank you, everyone, for being with us through those presentations. We're now in our third portion of our time together, which is the question and answers period. And so that can be for any of our HSS staff, our plan representatives here from Blue Shield of California and Kaiser Permanente. And the chat is open and active for anyone to write in their questions, and we'll be prompt and ready to respond. And I'll just give a few moments for anyone wanting to type in, get those questions clear and into our chat. And our staff will be turning on their monitors to make sure we can all see each other. And our first question is regarding any concerns that HSS may have regarding a recent news article about Blue Shields potentially laying off employees, knowing that this member is saying that the United Healthcare had served them well, and it wanting to know if it's a pretty opportune time if this were the case. So I'll hand that over to Charles with Blue Shield of California.
Yes, Holly. So we appreciate the concern, but we haven't heard about any changes in staffing at Blue Shield at this time. I know that there are a number of articles out there with other health plans and changing their staffing, but specifically here at Blue Shield, we have not been informed of any anticipated changes in our staffing model. So,
Thank you, Charles. Go to any others. So we have another person with, how does it work if you are living part-time internationally? Would you have to submit a claim after paying the bill overseas? And this person is sharing that their spouse, age 65, retired in July and doesn't receive Social Security. And he's currently covered by their CCSF MEA benefits through Kaiser. And is it best for him to stay on the Medicare A only or stay on the CCSF covered plan with Kaiser? Or add Medicare Part B. So will this go into effect January once that decision is made? So I'll hand it over to our plan reps.
So did you ask both questions? So there's the two separate questions. There's one on international. Okay.
Yeah.
So for international, Kaiser Permanente, you are only covered outside of our service area for urgent and emergency care. So if you're going to be living more than like a few months internationally, it's really not recommended that you remain with Kaiser because, again, you are not covered for routine care. You're only covered for emergency and urgent care. If something does happen, like while you're traveling, then you might need to pay the bill and then you would submit it to us for reimbursement for everything but the copayment for that service. Then the second part, my spouse is 65, retired in July, does not receive current. So in terms of whether it's best for him, what's best for him to do, I mean, if he is eligible to remain on your plan and you are the employee, then he does not need to enroll in Medicare because your coverage is considered primary to Medicare while you are continuing to work. So he would be able to stay on your plan, and then he can enroll in Part A if he chooses to, but he would want to defer Part B. In terms of would it go into effect in January if you make a decision? It sounds like he's on your plan right now. So if you don't make any changes, then he just remains on your plan. Olga, is there anything else you want to add to that?
No, I actually think you covered all of it.
Okay.
But I do want to just kind of stress the fact that um, once you're no longer employed, if your spouse is looking to transition to their own a retiree plan, just make sure that they are applying for Part B early enough so that they have that smooth transition and go into one of the Medicare Advantage plans that you choose, and they do not get hit with the penalty plan for not being enrolled in Medicare Part B. But we do give you the Part B late penalty waiver documents once you retire. So we would be able to help you out with that transition.
Thank you, Olga and Julie. The next question comes from John saying, I'm currently on CCSF Kaiser Group plan, but I'm retiring next month. So congratulations. And the question is, do I switch to Kaiser plus myself since I already am using Kaiser? Or does the city have a group plan for retirees that I should sign up through?
So the city does have a group plan, so I probably would need to turn it over to Olga. You would need to make sure that you have worked long enough to be eligible to be on the city's plan. So Olga,
Yeah,
I'll turn it
absolutely.
over to you.
So, as you are going through the retirement process, you will be connecting with the San Francisco retirement systems first to identify your years of service. Once you have completed that and you are 65 years old, you will want to connect with the health service. Sorry, you'll want to connect with Social Security to make sure that you're applying for Medicare. If you are still under 65 years old, you'll have to apply for Medicare once you get to the 65 years old age. And then you're going to want to contact the health service system. It is not a transition from active employee benefits to retiree benefits. It's not a passive transition. So you will have to submit to us documentation from the retirement system, along with your application for retiree benefits. And if you are 65 or over, you will need to submit your verification of having Medicare Part B. So there are several steps that you will want to take in this process, and we will be happy to do a in-person consultation or a phone consultation for you. We do ask for some patience since we're going through open enrollment right now, but if you are retiring within the next couple of months, please do make sure that you're reaching out to us so we could get that consultation specific to your situation done. But those are the 3 steps that you're going to want to take. Connect with the retirement system, get your years of service calculated, connect with Social Security if you are 65 plus, and then connect with us to submit all of the required paperwork so we can transition you to the retiree health plan.
Thank you again, Julie and Olga. The next question comes from Angela, who's asking, if I have United Healthcare with Medicare, have I been rolled into the Blue Shield automatically, or is there anything else that they need to do? And then the second question is, that they're letting us know they're out of country, so they're wondering if there's a way to compare the 2 plans, the Blue Shield of California and the current United Healthcare plan that's sunsetting at the end of this year.
I'll take that one. So there is no proactive action that you have to take in order to transition from your current United Healthcare MAPD PPO plan to the Blue Shield MAPD PPO plan. So you will be automatically transitioned. If you do have dependents who are not on Medicare and you'd like to do some plan changes for them for the available plans that they would have for the non-Medicare plans in the state of California would be Access Plus and Trio, and then outside of California will be the non-Medicare PPO plan with Blue Shield. So if you would like to do some of those changes for your non-Medicare dependents, you would have to take action before October 25th. And what I will do is I will add our benefit guide, which has comparisons between Kaiser and the Blue Shield plan to be able to see if you would like to change to Kaiser as well. That is something you'd have to take advantage of or take the option to make that change during open enrollment, and that's going to be through October 25th. So I'm going to go ahead and add that into the chat and pin it to the top so you'll be able to grab that comparison between the 2 available 2025 plan year plans for the Medicare population. Just one moment, I'll get that added.
Thank you, Olga. The next question comes from Regina. Is UCSF covered in the Blue Shield PPO?
Holly, yes, UCSF is part of our network. And just to add on top of that, the plan also provides flexibility, just as you have today, to be able to go out of network as well. So as long as your providers are Medicare participating and able to bill Blue Shield, their local Blues plan as well, your services will be covered under this plan. So even if it's in network or out of network, and nationwide as well, outside of California.
Thanks, Charles. The next question comes from Dwight. Do I need to enroll in Medicare A, B, and D independently, or is that all part of the retirement healthcare process? Also, it's a little confusing if they need to enroll in all parts of the Medicare. And that may be a question that Olga could answer. Let me know if I need to reread it again, Olga.
Sure. So for eligibility into a SFHSS sponsored Medicare plan for retirees, you are required to apply for Medicare Part A and for Medicare Part B. Medicare Part A it should generally be premium free for you. If you've paid into the system. If you're not eligible for Medicare Part A, you would just need to provide us with verification of having applied and then getting that either denial or premium. So then that portion of Medicare enrollment would be waived. But Medicare Part B is a requirement for eligibility with the health service system, and there is a premium to that. Please do not apply for an individual Medicare Part D plan. So we are covering you under our Medicare Advantage plans with a drug coverage. So if you do end up seeing one of those infomercials and apply for an individual Part D plan, you will be dropped from our plan. So make sure that when you're doing your research, you are not applying for an individual Part D plan.
Thank you, Olga. And I can see, Charles, you also responded to the question in the chat as well. So thank you. The next question comes from Victor. I'm retired from the City College of San Francisco. When I turned 65, I was removed from SFHSS and started Medicare. Am I able to join SFHSS Blue Shield again? That may turn it over to Olga.
As a retiree of City College, you can enroll right now during open enrollment in a retiree plan, as long as you've been certified as eligible by City College of San Francisco. So there is a couple of additional steps that you would have to take, unlike our direct employees with City and County of San Francisco. So City College does need to certify you as being eligible for retiree benefits with SFHSS. So you'd want to go first to your retirement office at City College and get that paperwork completed and get that over to us at SFHSS. And you're going to want to do that fairly quickly, since it sounds like there has been a gap between your employee coverage and the time that you've retired. So you're going to want to make sure that you're making this change or this enrollment during open enrollment. So my recommendation would be to connect with City College first to see if you are eligible under the rules that are available for City College employee or retirees, and then connect with us as soon as you can to get that paperwork to us so we could get that enrollment process started for you.
Thank you, Olga. The next question comes from Annabelle. Is Blue Shield part of the John Muir Hospital? And I'll hand it over to Charles.
Yes. John Muir is also part of the network. And once again, even if it's not part of the network, as long as the providers bill Blue Shield and are Medicare participating, you are covered as well out of network. And I think I forgot to mention that both the in-network cost share and out-of-network cost share for this Blue Shield plan is the same. So you don't have to worry too much about being in or out of network. It gives you additional flexibility. So.
Thank you, Charles. The next question comes from John, who's retiring next month and has Medicare Part A from the beginning of this year. Their question is, do I need to re-register for Medicare services early, like register now for next year? And if they do need to get registered by SFRS to Kaiser, will I still need to have the Medicare Part B? It's a multi-layered question, Olga. I'll hand it over to you.
So SFRS doesn't register you into Kaiser. What it really is that SFRS processes your retirement, identifies your years of service, and works with you to determine, based on retirement rules under SFRS, for what your pension is going to be. Once your years of service with SFRS are identified, then you're coming to the health service system, to us, to transition your active employee benefits to retiree benefits. And in order for you to be eligible, you will have to apply for Medicare Part B. As it looks like you may be already 65 plus, since you are mentioning that you have Medicare Part A enrolled already. And so what we will do for you is we'll make sure that we get you the correct paperwork to waive the late penalty for Medicare Part B enrollment. And with that process, we'll make sure that you complete the the retiree application for that transition of benefits. And what we'll need to see from you is the documentation that you receive from SFRS.
Thank you, Olga. The next question comes from Regina asking, will the recording of the meeting be shared with the participants? And I can answer that. We will have a recording on our SFHSS webpage under events. On this event, you'll be able to return to the page within 2 days, and we will have that posted with all of the questions available to re-listen and presentations. And we'll be able, by the end of the our time today, we'll drop in the chat that event page so you can easily click and find. The next question looks like from Anthony. Do you still need Medicare Part B if my spouse is on the health plan benefits with CCSF?
So I think I would need a little bit more clarification on this. So if you are retired but a dependent on your spouse who is still employed, you can waive you and your spouse, as long as they're still employed, can waive Medicare enrollment until retirement. If either one of you in getting benefits separately, if you are both city employees, if you're getting benefits separately, you're going to want to make sure that if one of you is still employed, that individual can still waive their coverage. But if the other individual is receiving retiree benefits, you will want to make sure that you are applying for Medicare Part B once the employed spouse leaves employment. So there are situations where there is that waiver. However, that only is in effect when one of the spouses is still an employee. Sorry.
Okay. Thank you so much. I'm going to scroll through, make sure I'm getting through all our questions. The next one comes from Anthony. Do you still need Medicare Part B excuse me, that was the one we just answered, isn't it, Olga? Let's keep moving. I know we've got quite a few. So the next question is from Valerie. For Blue Shield plan, what is the procedure if I'm traveling overseas and need emergency coverage overseas? Or even if I need medical attention that is not an emergency or urgent care situation? I'll hand that over to Charles.
Thanks, Holly. Yeah, so in urgent and emergency cases overseas, please go immediately and get care. You just need to pay the bill upfront, and we can provide you with claims submission forms, resubmission forms as well to get reimbursed once you get back home in the U.S. Unfortunately, though, for a typical care, routine care, that is not covered internationally, though.
Thanks, Charles. The next question comes from Dwight. Does my wife, who is retired but gets health benefits through me, need to have both Medicare A and B or just A?
That's correct. So dependents and members are required to enroll in Medicare Part A and B, and the way that it's required is for Medicare Part A, it's the premium free Part A, as long as you are eligible or your spouse is eligible for Medicare Part A premium free. You're required to enroll in that part. And then both members and their dependents are required to apply for and accept Medicare Part B, regardless of whether there is a premium, in order for them to remain eligible on a SFHSS sponsored plan. And that's whether you're eligible due to a Social Security disability or qualified disability, or at the time that you reach the age of 65.
Thank you, Olga. The next question comes from Michael, who's asking to share a little bit more information about Medicare Part C.
I can talk about Medicare Part C. So Medicare Part C is also known as Medicare Advantage. So both of the Medicare plans offered by City County of San Francisco are Medicare Advantage plans. So it's either the Blue Shield of California Medicare PPO plan or the Kaiser Senior Advantage plan. So you enroll in one of these Medicare plans, and then you're getting all of your A and B services. With Kaiser, you're getting it from our, our network of providers, because we're an integrated model. With Blue Shield, you are getting it from any provider who accepts Medicare, and if they're not already integrated with Blue Shield, they're willing to bill Blue Shield. I don't know, Charles, if you want to add anything.
No, I think you covered it. Thank you, Julie.
Okay. Yep.
Thank you both. And the next question, I would just also want to thank all the plan reps for getting into the chat and answering questions. I'm not going to reread those, but we're verbally answering them all so anyone can hear on the call. The next question comes from Sharon, who was bringing us back to Victor's question about contacting City College, which might be the one that Olga, you were responding to. And Sharon's just saying that it sounds like he removed himself from his plan. And so, Olga, if that's not a clear question, we can ask Sharon to request a specific question, unless you want to take that, Olga.
So since we can't share personal information on here, so the general recommendation would be for the member who asked the question is to connect with City College, go through and see whether they're eligible, and then connect with us to make sure that you're enrolling during open enrollment, because like I said earlier, it sounds like there's been that gap over 30 days since the date of retirement. And if that's the case, we want to make sure that we get you into a retiree plan if that's what you're looking to do. And you're going to want to do that before October 25th.
Thanks, Olga. And it seems like you already answered this question, but if you could speak it out loud. The next question came from John, who's asking for the contact number to schedule a one-on-one appointment with HSS.
Sure. So for an HSS retiree consultation, we can be reached at 628-652-4700. If you're looking for individual plan one-on-ones, those can also be scheduled. And I see Iris from Kaiser has already put in the link for the Kaiser scheduler. So these are available during open enrollment, and we'll make sure to put in the link as well for Blue Shield if you're looking to get a little bit more knowledge about the Blue Shield plan. One-on-one consultations for what the plan offers are available for scheduling online, and we'll get that link for you.
Thank you all for dropping those numbers in the chat. The next question comes from Annabelle. What's the difference between Senior Advantage under Kaiser HMO and Medicare PPO under Blue Shield of California? And it may be a big question to answer. I don't know if we need to send resources or links to those individual plans, or if there is a high-level response, whichever one could be best suited for us right now.
The benefit guide has been added, but I think it would be a good opportunity to kind of share from the reps just a little bit about the differences and similarities of each plan.
I mean, the similarities between the plans, I think both of them are built by what the health service system is, determining for what the benefits are going to be. Both of them cover everything original Medicare covers. Both of our plans have additional benefits, such as both of us have like a fitness benefit. Kaiser, our Medicare Advantage plan, is an HMO, so it's a health maintenance organization. Blue Shield is a PPO, but remember, they have the same costs and benefits for in-network and out-of-network services. Charles, I don't know if you want to add anything.
Yeah, Julie, I just want to say, yeah, exactly. I think both plans are very similar. It just depends on your needs, right? The one additional flexibility with Blue Shield is the nationwide coverage. The service area is larger and gives you flexibility, a little bit more flexibility to go in and out of network as long as the providers are Medicare participating and bill Blue Shield. I think on the Kaiser end of it, you've got that one central service model that often is good for folks as well. So it depends on your various needs that you're looking for. And both plans, lastly, have international and nationwide urgent and emergency care. So those key things are there nationwide and internationally. I think it just depends on what you're looking for to help you with your healthcare needs in your individual situation, which obviously you can call us, each of the health plans, or with HSS to help with your various, specific needs. So.
Thank you, Charles and Julie. And we can see now in the chat that the individual lines for both Blue Shield and for Kaiser Permanente are there for anyone who wants to speak to your teams and know more of those specifics. We'll keep going through. We're just about 10 minutes before the top of the hour. And I can see that Sharon, who's asked some questions, is looking for some answers around losing coverage. And I'll just go back, and Olga, and correct me if you're wrong, but member services would be the best place to go for individual confirmations about coverage. And that number, it was at the 628-652-4700. So Sharon, if that's the best place, our member services can help you with specific confirmation of benefits. Yeah. So I'll keep going through, see if there's any questions. We do have some time, so think through and keep going. And looks like Sharon is just wanting to make sure that the ways, and I could be wrong, but Olga, if you can just confirm the ways that someone can enroll in the Medicare medical plans.
So the last question I saw, so what I want to do is not have that conversation in the chat because it sounds like there's going to be a lot of member specific information. So that member, please do connect with City College. If you are eligible, connect with us at 628-652-4700 and we'll walk you through the enrollment process. But I don't want to share any more information about member enrollment and specific member information in the chat. So thank you.
Okay, thanks, Olga. I know we are here at HSS, we protect all of our personal health information. So getting and speaking one-on-one with someone is the best way to do that. And I can see that Iris with Kaiser Permanente put in the advisory number for anyone who's interested. And the next question comes from Valerie. If I need to be evacuated because of an emergency internationally, is this covered under Blue Shield, or is that only covered by traveler's insurance?
So coverage for urgent or emergency care are covered under Blue Shield's plan. So if you need any medical attention, please go to your nearest provider and get that care, and we will work with you after you get back home. So.
Thanks, Charles.
Charles, I think there's a difference between evacuation and emergency care. Are you saying Blue Shield will pay for the evacuation of someone?
Oh, I apologize. Thank you, Jessica, for that clarification. So unfortunately, no, evacuation services or coverages will not be, I guess, offered by Blue Shield. Only, let's say, for example, you've got medical care due to that evacuation and you need to go to a hospital urgent care. Those types of services, regardless of the circumstances, whether it's evacuation or not, are covered. So just to reiterate, any urgent or emergency care is covered, but specific evacuation services is not. So thank you, Jessica.
Thank you both. The next question comes from Annabelle. Are both Kaiser and Blue Shield offering free gym memberships when you turn 65 years old?
Yes, for Blue Shield, I think we responded there as well. And I think Julie is confirming too that both plans have free gym memberships, correct?
Thank you so much. The next question comes from Minna and is asking what is different, and this may have been addressed already, but the second portion is why are the plans called a PPO and why is a plan called an HMO?
Holly, I'll take that real quick. So I just kind of responded to the PPO plan gives you a little bit more flexibility to go in and out of network, whereas the HMO is more network based and focused with certain providers and relationships with those providers. So one gives you a little bit more flexibility if you need it, while the other gives you that focus within a specific area and plans. So.
Thanks, Charles, for pointing out the PPO plan. And Julie, is there anything else for the HMO, which is the Kaiser option?
No, I would say it's a health maintenance organization. So you do get all of your services from our Kaiser network. So you're going to Kaiser pharmacies, Kaiser hospitals, seeing Kaiser doctors.
Thank you so much. And then, Charles, you may have said this, but PPO stands for Preferred Provider Organization, correct?
Yes,
Okay,
I did not, but thank you, Ollie. All right,
okay.
you passed that quiz.
Okay, we've got about 5 minutes left. I'm just going to scan through to see if there's any more questions. Thank you again for plan reps to be putting questions in the chat, writing them out as we go through them and say them out loud as well. Let's see. So John is also following up about travel questions. John travels a lot, and he uses the travel evacuation policy that will go in if you have an emergency, stabilize you, and then bring you to a local hospital. And he's quoting that there's a cost of $110. So I'm not sure if the plan reps can speak to how that relates to what we offer, or if this is just John's experience.
Yeah, I think he's just suggesting that as a person who travels a lot, he has this travel evacuation policy. And then that can provide, that helps evacuate them until they can get somewhere. And then from that point, your Kaiser or your Blue Shield plan cover you.
Thanks, Julie. I know the questions are coming in about traveling. Our retirees are often seeing the world after they work. And it's really a good question to make sure what is offered within the benefits, and like what John is saying is a suggestion for outside coverage. So the next question comes from Michelle, who's planning to retire and is a little bit confused about transitioning to the retirement system and is wanting to know, how do they make an in-person appointment? I'm guessing with the retirement system. So Olga, I know you can speak to that. Yeah. And Olga, let's just make sure you're
Thank you, Holly. Yes, thank you. So right now in the chat, I put in a link for our website for getting ready to retire. I know it could be a complicated process, especially because what you're applying for retirement with your pension is a different department than what you're applying for as a retiree for your health benefits. So, and I'll just walk through the process just briefly as it's included on the website as well. So as you are looking to retire, the first thing you're going to want to do is connect with the retirement system so that they can look through and calculate your years of service, identify what your years of service are under the retirement system. If you are retiring at the age of 65, you're also going to want to, or close within 3 months of your turning 65, you're also going to want to apply for Medicare premium-free Part A and Part B with the Social Security Administration. If you are not retiring at the age of 65 or within the 3 months of turning 65, you're going to skip that step until you turn 65. And then you're going to provide to the health service system, so a different department, us, the retiree health benefits paperwork, along with the paperwork that you receive from the retirement system. Unfortunately, I don't know if the retirement system meets one-on-one or via call center with retirees who are looking to retire. They do have a website, sorry, not a website, but they do have a email address on their website to start the coordination of that process. However, once you're ready, or even now as you're looking to get someone to talk you through the health benefits retiree process, you can contact SFHSS for your health benefits as a retiree, and we're at 628-652-4700, or come into our office during our office hours during open enrollment. We're open 9 to 1, and then after daily, and then after open enrollment will be 9 to 1 Monday, Tuesday, Wednesday, and Friday, and then 10 to 1 on Thursdays. So we are open in person, and we do have a contact center where we can walk you through the health benefits process. And then, like I said, the website really lays out the steps for you to take as a retiree, and also has a retiree health benefits calculator that could be a tool useful for you to identify what your potential costs for healthcare as a retiree would be.
Thanks, Olga, and I can see that link in the chat. We just hit 12 o'clock. We have 2 more questions. I'm hoping we'll stay on and just answer them. One of them is from Raymond, and pointing out the difference between the referral system with an HMO and a PPO. And Raymond says that typically an HMO requires a referral to a specialist, but a PPO usually allows you to go to a specialist directly. I just wanted Charles and Julie to have an opportunity to confirm the process within our plans.
So with Kaiser, there are some specialties where you do not need a referral, mental health, OBGYN, and then many others you would need to either have an appointment with your primary, or often you can call or just email them, and then they will set you up with that specialist. Yes.
Right. And then on the Blue Shield side, yes, that typically is true. For a PPO, you have that additional flexibility. Let's say, for example, you have an allergy of some sort of skin rash or something like that. You can go directly to a dermatologist without going through your typical standard provider. So you do have that extra flexibility with a PPO plan. So correct.
Thank you both. The next question is from Diane, who's asking, does Blue Shield have anything other than silver sneakers? Diane's checked, and there aren't any facilities near her that offer the aqua exercise. And Diane's asking if they can go elsewhere to a place that does have that accessible to them.
So unfortunately, there is not that additional flexibility from a gym perspective. We're working with Silver Sneakers to always expand, and we're taking input from various retirees, including the health service system retirees, to where we can expand the network. But as of today, Silver Sneakers is the current option, or the only option with Blue Shield in terms of a free gym membership. So.
Thanks, Charles. And this last question, I think, will go to Olga. It's from John. Do we need to re-register for these plans yearly, or do they carry over unless you want to make changes?
Yes, so once you are enrolled in retiree benefits, they will carry over from year to year. So if you enroll in Kaiser this year as a retiree into plan year 2025, you'll continue with Kaiser. And if you make no changes and Kaiser is available as a plan year 2026, you will continue to enroll in the same plan as you previously had. And the same thing will go with Blue Shield. If you choose Blue Shield as your retiree health benefits plan, you will continue with that plan until or unless there is a change, or whether you make that or whether the plan is available for that future plan year. So there's no action necessary to take as a retiree once you are already enrolled in a retiree plan. The only action that you will have to take if you are not yet in Medicare, if you are a non-Medicare retiree, you will have to enroll in Medicare, and we will be transitioned into a Medicare retirement health plan once you become eligible for Medicare. So that's the only thing I want to throw out there, but annually, no additional action is required.
Okay. Thank you so much, Olga. And it looks like that was our last question. I did see that we dropped into the chat the re-recorded webinar series that's found at our website at the sfhss.org/events, and that'll be up within the next 2 days. Oh, there's one more question, and I think if we can stay on, Olga, this is some have just come through. If I'll do this one first. From Michelle. If I have an FSA dollar amount unspent when I retire, what happens to those funds?
So, as of your retirement date, you will no longer have access for new charges. But if you have any expenses that have not yet been claimed prior to your retirement date, you will still be able to claim for reimbursement on those.
Okay, great. Thank you. And then Valerie had a question. If I was in United Health, is it true that I don't have to choose Blue Shield if it was my choice? It will happen.
That's correct. So if you were in a United Healthcare Medicare Advantage PPO, you will automatically be transitioned to the Blue Shield Medicare Advantage PPO.
Okay, great. I'm grateful to everyone answering their questions. We're here live, being able to answer them in the chat. Thank you to our health plan representatives with Charles and Julie and Iris in the chat. Our website is live. We'll be able to look for the recording of this. And as Olga has said, our member services line is open and available for everyone with continued questions through the end of open enrollment. So thank you to everyone, and we hope you stay well and be well. Thank you.
Thank you.
Thanks, everyone.
Thank you.
Bye-bye.
Take care.